Meet Emily Griffin, an inspiring leader, a visionary educator, and a trailblazing pharmacist transforming the profession with her expertise and dedication. With a Bachelor of Pharmacy, a graduate certificate in pharmacy practice, and a Master of Clinical Pharmacy, Emily is credentialed consultant pharmacist. Her vast experience spans rural and metropolitan hospitals, community pharmacy, and academia, making her a well-rounded expert in the field. Her outstanding contributions have been recognised at the highest level. Emily was honoured as the Pharmaceutical Society of Australia's Early Career Pharmacist of the Year for Victoria, and is acknowledged both nationally and internationally as a leader in pharmacy practice. Emily is a credentialed expert in conducting medication management reviews, ensuring patients receive optimal care through safe and effective medication use. As a passionate educator, she plays a key role in shaping the future of pharmacy, lecturing and mentoring in undergraduate and postgraduate programs, while actively engaging in research to advance pharmacy practice. Beyond her clinical and academic roles, Emily uses social media as a powerful tool for advocacy, promoting pharmacist empowerment, fostering positive workplace cultures, and addressing healthcare disparities. As the Principal Pharmacist and Director of ENCAPSULED, Emily continues to lead with innovation, dedication, and an unwavering commitment to advancing the pharmacy profession. Emily Griffin, a name that echoes leadership, expertise, and passion in pharmacy. Elite Expertise is going to conduct a free webinar on Australian pharmacist scope now and in the future, this 5th April 2025, with Emily Griffin as the guest speaker. Don't miss this opportunity. Slots are limited, so hurry up and register with the link provided below. The pharmacy profession in Australia is evolving faster than ever. New roles, bigger opportunities, a future you need to prepare for. That's why we're bringing you an exclusive webinar with someone who has shaped the industry, Emily Griffin. She's not just a pharmacist, she's a trailblazer, an award-winning leader, an educator, and a voice for the future of pharmacy. With years of experience spanning hospital and community pharmacy, academia and research, Emily has influenced the way pharmacists work today. Recognised as Pharmaceutical Society of Australia
A very good evening to everyone. Thanks for attending today's session. And myself, I'm Arif Mohammed. And today we are going to have a brief discussion about the Australian pharmacist scope now and in the future. Okay. So in today's session, we have myself, Arif Mohammed, Mrs. Harika Bhimarpu, and also we have our chief guest, Mrs. Emily Griffin. Okay. So first of all, I would like to give you a brief intro about who we are and so on for those who are completely new. So we are Elite Expertise, which provide the training for overseas pharmacists to get registered in Australia, as well as in New Zealand, Canada, Ireland, and so on. So currently, we are giving the training for OPRA exam, for Australian licensing examination. That is the first part of the exam that anyone who is planning to become a pharmacist in Australia, so they need to clear this exam. And apart from that, we also provide the training for the intern pharmacists, like intern pharmacist written examination and the intern pharmacist oral examination. And we also provide the training for PPC for Canada, those who are planning to become a pharmacist in Canada. And we have launched, recently we have launched the PSI exam for Ireland. So those who are planning to become a pharmacist in Ireland, so for them, they need to clear this PSI examination. And well, I would like to go through a brief intro about what we are going to have in today's session, like the trends of pharmacy practice. So I will go in detail later on. Okay, but first I would like to invite our guest speaker. So our guest speaker today is Emily Griffin. So Emily is a Master of Clinical Pharmacy and she's credentialed for conducting medication management reviews. Currently, Emily works as a senior pharmacist at a major metropolitan hospital. She lectures and teaches for undergraduate and postgraduate pharmacy programs and also conducts the research. She was awarded by Pharmaceutical Society of Australia Early Career Pharmacist of the Year for Victoria and is recognized nationally and internationally as an influential speaker. So let's all please welcome Emily Griffin.
Thanks so much, Arif, for that introduction. And thank you to Arif and Harika for having me here tonight. Let me just make sure I can share my screen okay, and then we can get started.
Sure. Yeah.
Oh, wow. Can you see that okay?
Yeah, we can see this.
Yeah. All right, great.
Thank you.
No worries. I'll get started then, Arif.
Yeah, thank you. Go ahead.
So before we do get started, I do wish to acknowledge the Bunurong people of the Kulin Nation as the traditional owners of the land on which I'm presenting from today. I pay my respects to their elders past and present. And I also acknowledge the traditional custodians of the various lands on which you are listening in from today. We don't have long and there's a lot to get through tonight. Thank you so much for tuning in from wherever that may be to find out a little bit more about the rapidly transforming scope for pharmacists here in Australia. I hope you find it to be an insightful session. Here's a brief overview, just so you can keep track with where we're at, and hopefully we'll have time for a question or two at the end as well. Please note that the opinions shared throughout this presentation are my own and they do not necessarily represent the opinions of other organisations that I work within. All right. So firstly, it's important to define what we're talking about when we mean scope of practice and expanded scope, because it might differ here in Australia. So the Pharmaceutical Society of Australia has a definition of a time-sensitive dynamic aspect of practice, which indicates those professional activities that a pharmacist is educated, competent, and authorised to perform, and for which they are accountable. So that's our scope of practice. whereas expanded scope, or sometimes called extended scope, according to the Australian Pharmacy Council, is defined as opportunities that develop skills and knowledge within an area of practice not traditionally associated with a pharmacist's scope, for example, prescribing. It's an interesting phrase and interesting definition because it clearly states extended relates to aspects not associated within a pharmacist's usual scope of practice. However, some services pharmacists have been providing for a long time may once have been considered expanded scope, but are now part of our usual scope. So it's a tricky definition, in my opinion, and it does mean different things across different practice settings. So there's a bit of a movement towards this term, top of scope. The lines are a little bit blurred in this presentation because I want to give you as much information as possible in a short time, and because I do work across practice settings and have my own personal opinions and experiences. It's also important to note that these terms are different to advanced or advancing practice. So I encourage you to read into this if you're not familiar with the advanced pharmacy practice framework in Australia as well. To also better understand scope, we need to understand the changes in the pharmacy profession in Australia in recent years. Now the opportunities for career paths and practice settings for pharmacists are almost endless here, including GP practice and aged care, for example. I'm going to give you a brief overview of my journey as a pharmacist to help you understand where I've been able to expand my scope throughout my career and how expanding my scope of practice has contributed to shaping my career as well. I'm also going to highlight some aspects of rural and regional healthcare. So I grew up in regional Victoria in a town called Bendigo. You can see it on the map there for some context. And my pharmacy journey began halfway through year 12, which is our final year of high school, when I went for work experience down the road at a community pharmacy. I really had no idea what I wanted to do after year 12 before this experience. But it was the patient-centered care that this local pharmacy provided and the sense of community there that really showed me the impact that pharmacists can have on people's lives. I then went to La Trobe University in Bendigo as well, where I studied for 4 years. And I also worked concurrently in 2 very different community pharmacies at this time. One was a large discount chain, and the other was the pharmacy that I went to for work experience during high school. When I was going through my degree at the time, the expectation then was that I would end up working in either a hospital or a community pharmacy. And at that time, I chose to go to hospital pharmacy, which was, for me, I went 100 kilometres away to an intern pharmacist role in a town called Echuca in rural Victoria. I stayed there for a few years, working in various areas, including general medicine, palliative care, and oncology, which might all be considered specialist areas for pharmacists in hospitals. Rural health has this benefit, and also, I guess, a bit of a challenge, that you need to be a bit of a generalist and be able to handle any situation that comes your way, often with very limited resources. During my time in Echuca, I expanded my scope of practice with partaking in the pilot program at the time for partnered pharmacist medication charting. This is where pharmacists could chart medications for patients on admission to hospital in collaboration with the admitting doctor. After a few years in Echuca, I moved to Melbourne, which is the city, shortly after starting at a metropolitan tertiary hospital as the undergraduate coordinator, where I organised all the pharmacy student placements across the hospital. I then became a senior pharmacist, where I co-built the Australian first voluntary assisted dying statewide pharmacy service, which was quite controversial at the time, while working concurrently in general medicine, oncology, renal and acute and emergency medicine, to name a few specialties there. Throughout my time in various specialties here, I was able to expand my scope through co-building the Australian first statewide pharmacy service based on a brand new legislation here in Australia. And then all the other states in Australia based their similar services off Victoria's in the years that followed, which was pretty amazing. I also became credentialed again for partnered pharmacist medication charting, also known as PPMC, for therapeutic drug monitoring, which involved monitoring, reviewing, and charting some antimicrobials for inpatients, including vancomycin and aminoglycosides. I became credentialed for sepsis charting in the emergency department, which involved attending sepsis call-outs, discussing the different diagnoses with the emergency team, charting antimicrobials, and reconstituting or drawing up the antimicrobials ready for administration by the nurses. And that particular hospital also required credentialing for nicotine replacement therapy, for smoking cessation, for inpatients, and credentialing for chemotherapy pharmacists to review and sign off treatment charts and to order chemotherapy. There was almost endless opportunities for pharmacists at this hospital to expand their scope and to challenge themselves. So it was an amazing place to work from this perspective. One thing I will note in Victoria, which is the state that I live in, is that all the hospitals here are quite siloed. So everything, including the systems, the technology, guidelines, training, and even the scope for pharmacists can vary quite a lot between the hospitals. Whereas in other states across Australia, the hospitals are often more centrally run and they utilise the same systems and policies and procedures and so on. There are changes happening in Victoria which will lean towards more of a centralised system in the future. So while I was at this particular hospital, I also started my pharmacy consultancy business. So this is separate to my hospital job. And this happened when I completed my accreditation for home medicines reviews, which is another area of expanded practice for pharmacists in Australia. This involves a pharmacist receiving a referral from a doctor to go to a patient's home and review their medications, and then write a letter of recommendation to the referring doctor. In the background of these roles and experiences and scope expanding, I studied for an additional 6 years on top of my 4-year degree and internship. So I undertook my graduate certificate, the accreditation, now known as credentialing, for home medicines reviews, as well as a Master of Clinical Pharmacy. I then moved on to another metropolitan hospital where I initially started as the Senior Pharmacy Clinician for a Health Independence Program, which is a community-based hospital program aiming to keep people out of hospital. I also started my role as a Rural Pharmacy Liaison Officer, where I promote and support the rural pharmacy workforce. And during this time, I expanded some of the services I offered through my business ENCAPSULED. As you can see, my personal experience of expanded scope has mostly been hospital-focused, but there's also been a community focus in terms of the home medicines review aspect as well. And now I'm able to work across practice settings in some pretty exciting pharmacist roles here in Australia, and I have a very varied work schedule. So firstly, I have my consultancy business where I offer services for patients, including home medicines reviews, for health professionals and businesses, including educational health content, and I offer coaching for pharmacists because I love sharing my skills and my vast experience with other pharmacists to help them become better and provide better care in turn. So in particular, I love to coach pharmacists who are becoming credentialed in home medicines reviews or who have recently become credentialed in home medicines reviews, or those who want to build their confidence in that work. And I also find myself helping pharmacists diversify their careers, as you can probably imagine. An offshoot of my business is my Instagram page called The Encapsuled Pharmacist. And there I help combat health misinformation on social media and advocate for pharmacists. I also start conversations about health disparities between rural and metropolitan areas and about workplace culture. I'd love you to come and follow along. there's just so many fun and fulfilling roles we can have as pharmacists here in Australia. So the other practice settings I'm currently working in include a hospital as a hospital pharmacist, as the Rural Pharmacy Liaison Officer role that I mentioned before. And I find this is a way that I can help give back to rural and regional Victoria, even though I'm not living there currently. I also work within the undergraduate and postgraduate programs at a university for pharmacy courses. So I work as a skills coach for fourth-year pharmacy students. I also lead their rural health topic. I teach in the Master of Clinical Pharmacy, and I teach and examine in the new Medication Management Review training program for home medicines reviews, which I was also lucky enough to be involved with creating. I also have a couple of research projects on the go at the moment. So diversifying my career through additional training and scope has allowed me to really build a really rewarding and fun career. And in particular, one where I can help so many different patient groups and also help others in our profession. The expanded scope roles that I am trained for or now work in, I don't really now think of them as expanded scope. They're more just sort of part of my portfolio of expertise. And in my opinion, these roles help me provide better care to my patients. And I do believe that expanding our scope does improve our job prospects in this competitive pharmacy world in Australia. At the end of the day, expanding our scope as pharmacists is to relieve the pressure from other areas in healthcare and to deliver better care to our patients and communities. Just a couple of other areas I wanted to touch on in terms of scope that I haven't mentioned throughout my sort of personal story is those available in community pharmacy now, which includes pharmacists providing vaccinations. So pharmacists vaccinating for influenza and COVID, as well as travel vaccinations and other vaccines, including HPV, for example. That's human papillomavirus. There's also urinary tract infection prescribing that pharmacists are doing now in community pharmacy, and oral contraceptive pill prescribing. And I thought I would also mention a couple of services that may no longer be considered extended scope in community pharmacy here in Australia because it's been offered for a very long time, but other aspects including sleep apnea testing, skin checks and wound care that you may or may not have heard of us doing here in Australia before. I have mentioned quite a few of the aspects of expanded scope in hospital pharmacy, but just to recap a few, we've got the partnered pharmacist medication charting, which is now moving towards the phrase partnered pharmacist medication prescribing, which includes charting for patients on admission to hospital, charting for patients who come in with sepsis, patients who come in with stroke, charting nicotine replacement therapy, charting in oncology. The list is really endless here now. We've got stewardship pharmacist roles, including antimicrobial stewardship. We've got therapeutic drug monitoring, including monitoring and charting antimicrobials such as vancomycin or even posaconazole now as well, and other drugs like warfarin. And then there's also pharmacist outreach services and transitions of care. I thought I would also mention that pharmacists are becoming embedded now in all aspects of healthcare, which is very exciting in terms of our scope and our potential expanded scope, including GP practice pharmacists and aged care on-site pharmacists that I mentioned earlier too, as well as home medicines reviews, which has been around a long time now here. In terms of rural and regional areas, pharmacists in Australia are ideally placed to fully embrace their extended scope in rural areas, or our top of scope, as we might refer to it as. And this is for a number of reasons in rural areas. So in some rural areas, the pharmacist may be the only constant healthcare provider in the town. Perhaps there might only be a visiting general practitioner or doctor, for example, or maybe the doctor's clinic is only open part-time, or it may take a number of weeks to book in for a GP consult. Often pharmacists in rural areas need to be a generalist, which kind of allows us to take on extra roles and fill that gap. And the other aspect of rural pharmacy is staff shortages in rural areas, which makes for an ideal time to enter a rural pharmacy career. In terms of the future, in my opinion, I envisage that pharmacists will be working with extended scope of practice as the norm. So pharmacists are the medication experts, and wherever medications are, pharmacists should be, and our roles should fully reflect this in the future, as well as our remuneration. So it's a bit of a work in progress at the moment. Hopefully the extra credentials that we are undertaking in the hospitals and in community pharmacy may become part of standard training and practice for pharmacists here. And maybe in the future it might become part of our undergraduate courses as well. Also in the future, I'm hoping that the extra workplace credentials or training that we undertake in different practice settings, whether that be hospital or community pharmacy, become more standardized so that they are transferable qualifications across hospitals and states. Let's move on to my top 4 tips when considering expanding your scope of practice. So number 1 is why. So consider the reasoning for expanding your scope or considering expanding your scope. Is it perhaps career diversification? Is it because you want to help more patients? Is it for increased remuneration or job prospects? Really understand why it is that you would want to extend your scope. And consider your personal goals as well. So what is your long-term goal? How will this affect your progression, diversification, and advancement? And on this note, as I mentioned earlier, I believe that expanding our scope does lead to more opportunities. Top tip number 2, foundations first. So my recommendation would always be to become a competent pharmacist with all the basics sorted in Australia, and then we can consider expanding our scope after that. Number 3 would be priorities. And by this, I mean that our number 1 priority should always be patient care. And this should be our priority above any other drivers for us wanting to expand our scope of practice. And number 4, consider the education and training that you might need to undertake to expand your scope of practice. So what do I need to do to be adequately trained and adequately competent to provide this care to my patients? On this note, it's important to always remember the legality and insurance aspects. So what can I legally do as a pharmacist within my jurisdiction? Because again, this varies across different areas of Australia. And insurance. So what does my insurance cover me for? So there's a lot to think about there. I hope that it has given you a bit of a better understanding of scope of practice and expanded scope of practice here in Australia, and maybe a bit of an insight into some of the really exciting prospects of a pharmacy career here. Just my little references there, and a couple of QR codes if you'd like to connect. There's my website as well, and if you'd like to take time to fill out a quick feedback, I would really appreciate that as well. I think we have some time now, Arif, for a couple of questions. Is that right?
Yeah, of course. First of all, I would like to thank you, Emily, for sharing your knowledge. And yeah, we have been getting a lot of questions. We have a big
Sure.
list, but I just sorted out only 3 major ones. Okay, so which I would like to share it with you. The first question is, how can a pharmacist stay up to date and adapt to the changes in the pharma industry with the latest trends which are going up in the pharma?
Great question. I've got some resources here that I would probably send people to. Can you still see my screen?
Yeah. We
Yep.
can see the screen.
All right. So there's a few that I might just run through. So the Australian Pharmacy Council, they talk about accreditation and assessment of education here in Australia. The Pharmacy Board of Australia, you'll find information there around registration standards, codes, guidelines and policies, professional practice resources. The Pharmaceutical Society of Australia often has announcements around changing practice. They do a lot of advocacy work as well, and they have training. Advanced Pharmacy Australia, which was previously known as the Society of Hospital Pharmacists Australia, and they are more sort of hospital focused. I didn't actually include them on my slide, I don't think. The Pharmacy Guild of Australia, there's this great little part on their website called Find a Pharmacy, and underneath that you can read about different pharmacist services available here as well. The Advanced Pharmacy Practice Framework, which I mentioned earlier in my presentation, just around advancing practice in Australia. And then insurance for pharmacists. And the main one we have here is the Pharmaceutical Defence Limited.
Yeah, thank you so much. And the next question is, what new skills and knowledge does a pharmacist needs to acquire to sustain in the future with changes in the industry and so on? So what skills that the pharmacist may need?
Yeah, that's a great question. And I guess that kind of comes back to understanding our current scope and what we want our future scope to look like, as well as what practice setting we're working in. So I think it's really individual, that the answer to that question. Yeah, I don't have a great answer for you there, Arif.
Yeah. Okay, Emily. Yeah, then the last one, and what's the scope of pharmacists in regional Australia when compared to metropolitans? Like, as you have worked in Echuca, and then you have moved to Melbourne, like what sort of the difference that you have found? And when it comes to the scope there in regionals, like how the scope will be there in the regional Australia, or in the regional, either in the hospital side or in the community side?
Yeah, oh, there's so many great questions coming through. Yeah, I would say that they're very, very different areas to work in. I would say, as I mentioned, that often in rural and regional areas, you've got to be prepared for anything that comes your way, and you've got to be a generalist. So you've got to get a lot of experience, and you do, just because you're exposed to so much in rural and regional
So
areas.
much things, yeah.
Yeah. And I found then when I moved to Melbourne that I had quite a lot of experience, maybe more experience than what maybe people that had trained in the city had. Yeah,
exactly. So the same thing with me, like even I worked in Echuca first, and then I moved to Swan Hill. Like it was like completely a different experience when compared to the Melbourne hospitals experience. So where we must be ready to in case if someone is not there in the emergency department, then we need to go there in the emergency. We need to cover the acute ward. We need to cover like the subacute and all the things in regionals.
Yes.
Yeah. So once again, like thanks for joining us this evening and sharing your insightful and inspiring words with us, Emily. And I'm confident that all the participants have greatly benefited from your words and feel more equipped to face the challenges and opportunities that lie ahead for them. So once again, thanks for joining and making this event a resounding success for us.
Thank you so much for having me, and thank you everyone for joining. I hope it was valuable.
Yeah, thanks, Emily. Thank you so much. Yeah, bye. And please stay tuned with us, guys. So we still have a few other events which is going to happen. And now I would like to pass over to Sahana before the next speaker, Harika ma'am, she comes. So I would like to pass it over to Sahana.
Hi everybody. I hope the session was really great. Emily has spoken about so many things. Her experience has shared so many insights that we should take into consideration for our future perspective. Before we start, then I hope you must have had a lot of questions. Emily was not there with us, is not going to continue with us further. But then, if there is any other further questions, please share in the chat box. And Arif and Harika will be here further to answer all your questions. Yeah, now let's hand it over to Harika to just take over the session. And so, guys, any other questions that you wanted to know about the future perspectives? Any other questions that you had, you can just let us know in the chat box, or please tell us. I mean, unmute yourself and you can just tell us, ask us anything that you want to know. Arif and Harika are going to further talk about many other things. Yeah, Harika is here. Hi, Harika. You look
Hi,
great.
Sahana. Thank you so much. Thank you so much, dear. You too. So let's start like the agenda of like today's session, which I'm going to present. It would be a short presentation, and then we can jump into question and answer sessions. So I hope you've found the session so far informative. Presentation by Emily was really great. So today the topic which I would like to just throw some light on is hospital pharmacy practice. Myself, being a clinical hospital and clinical pharmacist in Australia. Like a lot of people ask, what is the difference in the hospital practice? How pharmacists are play a major role in hospital practice. So what do actually the pharmacists do in hospitals? Because like pharmacy means community, dispensing medications and counseling the patients. But apart from that, what really happens in the hospital is what today I'm going to discuss about. So pharmacists have so much role to play in the hospital practice, and it's like a hot cake in Australia. Getting a hospital position is a hot cake. You should have a significant community experience, and you should work for some specializations, good knowledge acquiring, good continuing professional development activities to really secure a hospital position in Australia. It's not maybe the grade 1 position these days a little bit. It has become much easier, but during our time it was much more difficult. But things are getting better. The ratio of patient to pharmacist has been increasing. So we are trying. The government of Australia is aiming. Department of Health, the funding and all that. They are aiming for more pharmacist ratio per patient to prevent medication misadventures. So what does a hospital pharmacist actually do? So clinical hospital and clinical pharmacists, they do best possible medication history of the patient. They conduct medication reviews while in hospital, and they see any dose mismatches or dose adjustments needed for any medications, any drug-drug interactions. If the patient has been on any medications before and has admitted into the hospital, and suppose any disease condition has been left untreated, they advise the house medical officers, the registrars working in hospital, the doctors to start and initiate a therapy, because hospital is a very good system where you can integrate the healthcare management, the healthcare plan to the patient in a better way, because compliance issues do happen in community, whereas in hospital you can initiate something. Suppose a patient is smoking and doesn't even know if he has any opportunity to quit smoking through medication management. It's a very good point for us to start a nicotine replacement therapy in hospital, and that if the patient likes, he can continue in community and then get an advantage of quitting smoking, all the benefits, again, smoke clinical. So we kind of do so much for the patients. And the ratio has been amazingly increasing over the past few years, and there's so much scope, I would say. But just to keep this presentation a bit shorter, special thanks to Emily for presenting in today. So cardiology pharmacist. So a specialized cardiology pharmacist, they work in coronary care wards, cardiac units. They treat heart failure. They help in the medication. They help in the medication management, designing according to the symptoms, providing symptomatic relief, preventing hospital admissions, frequent hospital admissions, and prolonging the lifespan. They liaise with the doctors. We have dedicated heart hospitals in Australia, like we've got Victorian Heart Hospital, dedicated only for heart patients. And then there is like a cardiology specialist pharmacist working in it. Every year, Society of Hospital Pharmacists Australia conducts education sessions on specialist cardiology practice. There are specialist groups for pharmacists involving in cardiology care, and they are involved in research and development in improving cardiac treatment outcomes in the patient. So the best, it is the best specialty. Pharmacists enjoy it a lot, from inpatient services, rehabilitation services, in everything which is dealing with medications. Pharmacists are involved in the bigger hospitals, especially Victorian Heart Hospital in Victoria. Dedicated cardiology research centers are present, and pharmacists have a research role and a daily clinical role to play in the cardiology care. So that's the cardiology specialization. And it has been even the board certified pharmacists are getting that extra edge to get into this cardiology specialization. But SHPA is the best bet for someone who has that interest and wants to develop a specialist knowledge on cardiology pharmacy practice. And then we have, sorry, for some reason this is not moving. Critical care specialty pharmacists, ICU pharmacists, intensive care unit pharmacists. They need to mainly in critical care units. And then it's a mixture of both emergency and ICU medicine, like intensive care unit. So it's very challenging role, and they expect a very high knowledge base for the pharmacists performing. And the trauma hospitals, hospitals which deal with accidental care and trauma, are amazingly employing pharmacists and involving them in partnered medication chart management. There are some small pilot programs in Australia where medication chart, what medications the patient should be on, is prepared by a pharmacist in liaison with doctor, helping and taking the role of medication management and helping the doctor in a better way in the treatment regime designing. So it has been a very good, the scope has been on a higher trend. It has been increasing in these areas, critical care and ICU medicine. And as again, Society of Hospital Pharmacists Australia is where you go and seek for more resources to develop your expertise in these specialties. General medicine, so very common. It has been there for ages. Gen Med pharmacists, we've got so many themes in Gen Med pharmacists because it's so vast and the patient ratio is very high in this specialty. A general medicine pharmacist is a generalized pharmacist, and he can nicely fit in any role. He works we have cardiology patients admitting into general wards, general medicine specialties, rheumatology, immunology, endocrinology, critical care. Everyone gets into the general medicine, general wards, and then dealing and talking to the patients, getting the history, medication management, interaction checks, dose checks, recommendations. Everything is so generalized. And I feel the general medicine pharmacists are a jack of all trades. They get the best knowledge of every field, and they're able to handle a lot of a diverse population of patients. And I think this specialty is evergreen. It's going to be there forever. A couple of interviews when I attended in one of the Melbourne hospitals, they asked me, did you work in general wards? We want a general medicine specialization pharmacist. What is your general medicine experience? And I still remember that interview. So it is an evergreen subject, general medicine specialties, and we have got huge ratio of pharmacists working in the public hospitals throughout Australia in this specialty. And then geriatrician, mainly in the wards, subacute wards, where a geriatrician is involved, and then the patient gets admitted for long-term care, or even in the community, we have consultant pharmacists who deal with the geriatric population, all the aging population, where deprescribing is the main bet, like deprescribing medications and optimizing and writing reports to the doctor, and home medication services are being provided by the pharmacist, where the pharmacist goes to the patient's home, sees how the bottles are stored, expiry dates, and writes the report, hey, there's a false risk with this kind of medication, try to dose optimize it kindly. And to the other healthcare professionals, designing a healthcare plan for the patient. So geriatrician plays a major role, and geriatric pharmacists in liaison are doing an amazing job, but this is more like you have some exposure to the outpatient setting, like accredited consultant pharmacists who go to the patient as outpatient, where the elderly people are living in the community, and then liaising, or if a hospital admission takes place, and if a pharmacist realizes that this patient has some issue in managing medications, then there is a humoral referral which is done, and then we go to home and see those patients. So that's geriatric specialist pharmacists are there. And then we've got, some reason this doesn't move, infectious disease specialties, amazing. We have pediatric infectious disease peds pharmacists, infectious disease adult pharmacists. So pharmacists form a team they are a part of antimicrobial specialty team, where they do therapeutic drug monitoring. We have specialist TDM pharmacists only doing TDM, therapeutic drug monitoring, and dose adjustments, dose calculations for antibiotics like vancomycin, and then what medication to recommend, what dose adjustment to be needed in case of infectious diseases, susceptibility testing. And then we have we have traffic lights in hospitals, where what antibiotic can be prescribed easily, which antibiotic has more restrictions. So in those areas, a pharmacist forms the part of antimicrobial stewardship team, and then helps in TDM, prophylaxis antibiotics. And in this infectious disease specialization, giving approval numbers for doctors to prescribe a particular antibiotic for a particular infection, if it's really worth it, to prevent antimicrobial resistance. So in this specialty, we play a very key role, and we will be very vigilant in the stewardship. And it has been amazingly, like, pharmacist involvement has been amazingly increasing in infectious disease specialties. I would say the surgical pharmacists, actually, we've got surgical pharmacists, especially doing prophylaxis in liaison with the infectious disease specialist pharmacist. Suppose there is a surgery, you need to prevent any infection in surgery. So you need to design a treatment regime for surgical prophylaxis for the patient. So you have to help doctors in finding the right antibiotic during the surgery. So surgical pharmacist basically deals with post-surgery and pre-surgery management of medications, along with liaising with infectious disease specialties to prescribe the prophylactic and treatment antibiotics, because surgery is a place where you need antibiotics to prevent any infections. And then we have infectious disease pharmacists involving in HIV medications, sexually transmitted disease medications, and then TB, tuberculosis drug optimization, etc. So there's massive scope here as well. And amazingly, teenage population, children, and are more prone to mental health issues these days. It has been increasingly, like, mental health issues have been increasing in our community. And apart from that, we've got like pregnant women getting into postnatal depression management, mother and baby units, where you have to help both mother and baby cope up with the new onset depression, schizophrenia symptoms, psychosis, bipolar disorders, suicidal tendencies, post-traumatic stress disorders, obsessive compulsive disorders. So mental health pharmacist deals with all these, both in outpatient and emergency, outpatient and the inpatient settings. And it's a very interesting domain. And then mainly, the pharmacist who is working in mental health wards are very versed with psychotic medications management, dose adjustment, anxiety, depression management, dose adjustments, how to discharge, what to discharge, how to wean a patient on a medication, how to start a medication, etc. So, and then we've got nephrology specializations, like mainly the transplantation, kidney transplantation units, where pharmacists, people with kidney transplantation, history of kidney transplantation, or people undergoing transplantation, or people who are on dialysis. They're on massive list of medications, like heaps of medications, and often patients get confused with those medications. So a pharmacist is really very much needed in the nephrology ward, because some medications, patients with kidney impairment, they need renal dose adjustments, and pharmacists has so much role to play in these areas. So we've got nephrology specialized pharmacists, renal specialization, and then research. Renal plus research is being like wide, like an acclaimed position where you have involvement in research and development, and then you involve in the clinical aspects as well. So it is amazing specialty as well. Neurology, like epilepsy and other neurological issues, treating interesting conditions, managing and treatment of these medications, dosage regimes, has been like neurology ward, neurosurge, like again, you have a surgical pharmacist helping in neurology, like specialized patients. So you've got amazing scope there if you're looking for advanced pharmacy practice. And then, and not this is the specialization onc and hematology, which is like going to become evergreen, because like cancer cases are widely increasing. And then we've got onc specialist pharmacists who deal with wide range of cancer medications, treatment protocols, approving treatment regimes, checking the doses, body surface area dose calculations, administering immunotherapy. Like again, the nurse would be involved, but like dose adjustments, treatments. Suppose a patient is on doxorubicin, daunorubicin, then giving dextroxane, like, to prevent cardiotoxicity. So all these are being dealt in a both we have ped oncs, like pediatric onc, adults onc. So, and then hematology specialist pharmacist. So I think after general medicine, this is the specialization which has like a very good demand, I feel, in the coming future. This is my prediction. And then we've got specialist peds and neonatal specialty pharmacists who deal with infants and children issues. They both deal with PICUs, like pediatric ICUs, and then pediatric, like they help in the total parenteral nutrition calculations for the patient. Again, special care nursery pharmacists are there, especially who go and like look after the babies in the special care nursery. So this peds, like we've got dedicated children hospitals throughout Australia, and ped pharmacists and neonatal specialized pharmacists are working in those areas and playing a brilliant role. And then outpatient clinics, mainly chronic pain has been like in the community. We've got like chronic pain management has been an issue. And we've got so many pain relief options, but again, those drugs are associated with side effects. So we need a pharmacist to help in side effect management. Again, when it comes to elderly with chronic pain, there's a false risk. So this has been like, we've got like, especially in my previous, when I was practicing in community, I've done a lot of pain trials where we have liaised with psychologists, exercise physiologists, pharmacists, and GPs to help in chronic pain management. Exercise is the one which plays a major role, but again, medications is what they need to treat the chronic pain, and again, optimizing the therapy. So it's more outpatient, and again, you have these subacute wards, long stay patients who need really pain management advice and help. So we are pretty much like involved in all these areas when it comes to the pain management specialties. So apart from this, I would say palliative care, people who are in the end of their life and there is like a life-limiting illness and they just need comfort measures and pain management and optimizing the medications. This is where the deprescribing comes. We don't need to give the patient all the medications. The patient who is actively on a deathbed. So we need to de-prescribe, what to de-prescribe, what not to de-prescribe, how smooth the process of death should be, how comfortable it should be for the patient. So we've got a dedicated palliative care team where a pharmacist involvement is much more there in this area. And then we've got respiratory specialist pharmacists helping in asthma, COPD, and other respiratory condition management. Other than that, in community practice, we have compounding pharmacists who deal with preparing mixtures like melatonin suspensions or special like suspensions which are not generally available, readily manufactured, but we compound and prepare it. And the pharmacist has a compounding license to do that. And then we have got dispensary pharmacists who are amazingly helping discharges, outpatients. And then we've got pharmacist educators who train the pharmacists and students and interns to get the best flow in the work, and then just to help in the best practices and to enhance the quality. So education is a part of life, part and parcel of in the life of every pharmacist. Every pharmacist involved in the education of interns and students. The place where I work, like we have so many student pharmacists coming from the university and intern pharmacists, and it's a part of a training. Education is like a continuing process, but we do have specialist pharmacist educators who do more pharmacist education and then clinical facing roles as well. And they work in quality improvement of the pharmacist working. And then we've got informatics pharmacists who deal with medication information services. It's an amazing area. I would love to work there. And we have drug information services, phone call answer to the patients, giving the information, because many patients are puzzled about what drugs to use. What is the use of the drug? Why am I on the drug? How to use the drug? What is the side effect? So medication information, and just not for patient, but for the different healthcare practitioners like GPs, specialists, they very much utilize those medication information services. And then we have from the pharmacists, and then we have adverse drug reaction pharmacists, medication safety pharmacists. So basically, it's all informatics kind of information services. And then we've got research pharmacists dealing with clinical trials, surgical pharmacists, and special pharmacists dedicated for maternal ward, where you're dealing with the women, reproductive care, and newborn health and well-being. So we have women hospitals, specialized dedicated women hospitals, where we have dedicated pharmacists dealing with the gynecology, obstetric aspects of the women. So there is so much scope and so much. And then we've got GP pharmacists sitting in a GP clinic and helping GP manage the medications of the patient. So there's so much. And consultant pharmacists, diabetes educators, pharmacist asthma educators. So there is, this is just like a presentation to quickly give you a rough idea. Hello? So just to give a rough idea about, what's the scope and how you can practice in multiple domains and how you can enhance your profession. So a community pharmacist, Sajid is asking, Rimsha is asking, community pharmacist mainly deals with, so his works in liaison with GPs, general physician, and also specialists. And mainly they deal with the outpatient management. And we've got so many like community pharmacies in Australia. The ratio of community pharmacists are higher in Australia compared to hospital pharmacists. And then we've got, and someone asked me how to get into these roles, specialized roles. You keep your practice going, take a role whichever you get offered to, and start working as a pharmacist. Enhance your knowledge and practice by specialized training programs conducted by Society of Hospital Pharmacists if you're trying for a hospital position. Apply for interviews, learn how to give interviews, get into a role, basic role, rural role, or maybe move into rural regional areas. That's how I got my position. And then enhance your skills, enhance your specializations, and then you would get your dream job. It doesn't happen overnight. It takes consistency and hard work. Okay. So I think I will end my presentation and I'll over it to Sir Arif for question and answer. Sahana, can you manage while I just adjust mic and give it to someone else. Yeah.
Sure, sure. Harika, that was such a great session, I would say. I
Thank
didn't
you.
know that there were so many, branches of the pharmacist specialists like nephro, cardio, onco, hematology, pediatrics. There were so many guys. You just carry on. I'll just yeah. So did, just put it in the chat box. Did you all know that there were so many sessions, so many specialist pharmacists available there? And all that I knew was he would deal with the prescription dispensing of the drugs and everything. Many of us weren't aware of all these things, but now that Harika has made it so clear to all of us of what they do exactly, what are their roles of each and every, and very well said that general medicine specialist is the jack of all trades. He deals with many of the scenarios and all the specialists. Yeah, Shirali says she knew about all of the things. So who else knew about the spoken specialist pharmacist, specialty pharmacist branches? You can put it in the chat box, guys. Let's make it more interactive. Thank you so much, Harika. It was such a great session. And I must say, there are many questions that are popping in, and the chat box is open now. So, yeah, we have plenty of them. Let's wait for Arif to continue, and we will go through all of these.
Thank you so much, Sahana. And well, I would like to just share one thing, because many students, they have been asking me like how the pharmacy practice it will evolve in the future. So not only in Australia, but all over the world, like in Canada, as well as in US and so on. So the only thing that I would like to share with a short, like three simple slides that I would like to share. And I hope you all can see here, guys.
Yes, Arif, we can see.
Sorry. Okay, so the trends of pharmacy practice. Okay, so like when it comes to the pharmacy practice, guys, like it has been improving like all over the world, not only in Australia, but all over the world. The demand for pharmacy has been increasing. So this is the pharmacy, like like a chemist shop in back in 1910s or 1920s. So during that time, a chemist or a pharmacist, in the sense, just he will be compounding few simple things, and he'll be giving it to the patients just for treating the minor, like some minor issues or for the minor problems. But when it comes to 1990s, okay, or in early 2000, then especially in the hospitals, like the role of the pharmacist have started increasing in the hospitals. So in the hospitals, like they started like from the simple procurement of the medications to dispensing the medications, and also they started counseling the patients, okay, and providing the medication information to the patients. And slowly the role has been increased. But let's have a look through the current role of pharmacist in hospitals, for example, because even in community sites, the role has been expanding. So I'm just emphasizing on the hospital ones. Okay? So this is the current role of pharmacist in the hospitals at the moment. So not just the dispensing and or compounding and counseling the patients. So nowadays, like the role of pharmacist in hospitals, it has been broadly, it has been expanding. Okay, so just now, Harika has gone through all the important like specialties where a pharmacist can practice. So pharmacists can practice in oncology, as a cardiology specialties, as a critical care, emergency, general medicine, geriatrics, infectious diseases, mental health, nephrology, neurology, pediatrics, pain management, palliative, respiratory, clinical trials, surgery and pediatric care, and women's and newborn health. Okay? And these are all the ones that have been recently evolved. And now the only thing that I can say that this trend, it will never end. Okay? And this role will keep on increasing. Okay? And even in the community side, as Emily has shared, a lot of things like the pharmacists, now we have got the prescribing rights for UTI problem and for few other things. And at the same time, we can do the home medication reviews, that is the residential medication, and also the residential medication management plan. So these are nothing but all the roles, like day by day, like year by year, they have been increasing. Okay? And when it comes to the vaccinations, so in Victoria, like we have the authority to give the vaccine for most of the common conditions. The pharmacists, they will be giving the vaccines. Okay? So these are the ones that they have been increasing, and they never end. Okay, so they still will keep on continuing. And one more common thing that most of the candidates that they have asked me, even in the previous webinars, that as recently nowadays, like we can see the AI has been introduced, and AI has been like it has been covered almost all the market. Okay, so whatever the field that you go, you can see the AI there. Then the candidates, like most of the students, they have asked me, what about the future of pharmacists? So will it be completely replaced with AI? Then my answer is no, it will never happen. Okay, because the role that is played by a real pharmacist, it can't be done by the AI, artificial intelligence, or the robots. And not only in the pharmacy, in all the medical sector, in the medical field, like for the doctors, nurses, pharmacists. Okay, so we have the demand. So whatever the technology it evolves, okay, so we can, yes, of course, those technology that will help us to simplify the things. Okay? For example, now recently in the hospitals, we have got the EMR facilities. So where earlier we used to do everything in the paperwork, but now we have the EMR technology. So where it simplifies the things, like during patient's admission as well as during patient's discharge. Okay? So it will help the pharmacist to simplify the thing, but it will never replace the pharmacist. Okay? So these are the few things that I would like to add and my presentation. But in case if you have any queries, guys, then you can just ask me. And please don't forget to like give a feedback to Emily. Emily has shared the feedback form with you. So please don't forget to give a feedback, and also just follow her on her Insta and on her Facebook and so on. So now we are open to any questions that you guys have.
There are many questions pouring in, Arif. So to begin with, to become a specialized pharmacist in one department, do we need to do special courses, or just work in the departments? Neelima is asking.
Yeah. So to become a specialized pharmacist in Australia, for instance, like if you want to become a cardiology specialist or oncology specialist, okay. So the thing is that at first you need to start your journey as a generalized pharmacist. Okay, so that's what even Emily has shared it with you guys. So at first we need to start our journey like a generalized pharmacist. Even I worked in the regional hospitals in Australia. So in the regional hospitals, the reason why we are emphasizing to work as a generalized pharmacist is in the regional, especially in the regional hospitals, they don't have much of the specialties. So let's say, for instance, if you are a specialized pharmacist in cardiology specialist, okay, but if you move to the regional hospitals, there you can't find that position to work there. So my advice is that first we must become a generalized pharmacist, and then when we move to a bigger hospitals, and in case if they have the option up over there, then we can start doing our rotations. So in all the hospitals, in metropolitan hospitals, like we'll have almost all this department that I have shared it with you. So where you will be having a rotations. So every year, so if this year if you work in the cardiology, and next year they will post you in neurology or some other department. So with that you will get the overall exposure and the experience. And to become a specialized one, for instance, if you want to specifically if you want to become an oncology pharmacist, okay? So for that, as you need to focus only on the particular field, and yeah, then you will get the positions only in that particular aspect, like becoming an oncology specialized pharmacist.
Okay, that was some great question. And Pushkar is asking, I'm from Nepal, practicing as a clinical pharmacist in Nepal. I have total experience of 8 years in hospital. I have passed KAPS on July 2024. What are the options?
Yeah.
Um,
Sorry, your voice is not audible, Sahana.
can you hear me now?
Yeah.
Yeah. So he has a total 8 years of experience in hospital. He has passed KAPS July 2024 batch. And then he's asking if what options will be better for me, intern pharmacist or PR pathway to move to Australia? What is the current trend of opportunity to work for overseas pharmacists in Australia?
So the thing is that for all the overseas pharmacists, the first thing that you need to do is we must try to complete our internship. Okay? And when it comes to the internship opportunities, you can find the internship opportunities mainly in community pharmacies rather than in the hospitals. Okay? So because of the limited hospitals in Australia and limited intern positions in the hospitals, so finding the internship in community is much easier than finding in the hospitals. Okay? But once after you finish or after you complete the internship, then you can try to in case if you have a good clinical experience, then you can try to move in the hospital side. And yeah, community pharmacies and the two regional areas will have more opportunities when compared to metropolitan cities.
Now that you have spoken about region areas, Arif, could you explain us, like we have been hearing from many pharmacists like you that regional areas are helping us a lot. But what is that they can
Yeah.
learn in specific from regional areas rather than the rural and the urban ones?
Okay, sure. So the main thing is when it comes to the initial opportunities. Okay, so the initial opportunities, like most of overseas, especially I'm talking about the overseas candidates, initial opportunities like they can find mainly in the regional farm, like in the regional areas, like either in the community side or in the hospital side, because in regionals, the pharmacy owners they will be struggling a lot to find the interns, or they will be struggling a lot to find the fully licensed pharmacists to work over there. So that's why the opportunities will be more in regionals. So when compared to that of major metropolitan cities. So that's why for any candidate, those who are migrating to Australia from overseas, so I always recommend them to look over for the jobs in the regionals, okay, rather than trying for here in the metros.
Pushkar again is asking, what is the current trend of opportunity to work as an overseas pharmacist in Australia?
Yeah, the trend to work as an overseas pharmacist, since even I'm an overseas pharmacist. I studied in India, and right now I'm a pharmacist here in Australia. So even like my journey, even I can share a few things, like even from my journey, like at first I worked in the regional Victoria. Okay, so I did my internship in a community pharmacy, and then I moved to hospital, and then I become a clinical pharmacist. I worked as a hospital or a clinical pharmacist over there. And from regional experience, then I moved to Melbourne.
Ijuni is asking, I hope I spelled it correctly, but sir, may I know which country have most opportunities, New Zealand or Australia, and regarding securing an intern position there?
It depends, like whatever the country that you are targeting. So Australia, like if you all know that New Zealand, like area wise, it's a small place when compared to that of Australia. So Australia has got much huge population when compared to New Zealand, and at the same time a large number of the pharmacies and hospitals. So everything is much bigger in Australia when compared to New Zealand. But again, it depends upon you guys. Like in case if you already have some family members and the relative support there or friend support there, and already if you have any good network in New Zealand to find the internship positions, then yeah, you can go ahead in New Zealand and you can do that internship position. But there's also another option that is available. So that is known as the trans-Tasman pathway. So for instance, even if you become a pharmacist in Australia and later if you want to move to New Zealand and practice up over there in New Zealand, so you can still do that. Okay? So by trans-Tasman pathway, so your license will get recognized in New Zealand as well. Okay, so just you need to do some just for a few hours of supervised practice, and then with that your license, you can get the New Zealand license and you can practice up over there.
Okay. It's the name is unknown, but they're asking if I get an intern offer letter from hospital, is it better to join in hospital or community? Which one will be better option?
If you have the passion to work as a clinical pharmacist, okay, so to become a clinical pharmacist, then that's the best option. If you already have a offer letter from the hospital, then go ahead, finish your internship, and then you can you will become a pharmacist in the hospital, and then you can start your journey as a clinical pharmacist in hospital. Okay. So if you are already mentioned that you got the offer letter, then I can say that that's the best option. So you can just start your internship in the hospital.
Hello, Arif sir. So this question
Yeah.
is to both Emily and Arif sir. Like, how does a typical day of a hospital pharmacist look like? I hope she's there on call.
Uh, yeah, I can share my insights, like how it will be.
Yeah.
So a hospital pharmacist, in the sense, a clinical pharmacist, like in almost all the hospitals in Australia, okay, the main thing is the job is a bit challenging one. Okay, so challenging. Why it's challenging? Because every day, like we need to cover a lot of the things. So we need to sorry, can everyone make sure that your microphones are turned off? So like every day we'll keep on getting a new challenges and the new tasks in the hospitals. We'll keep on getting the doctors in the ward rounds, so they will keep on asking us what alternate therapy that as a pharmacist we can recommend. Okay, so which means that we need to go through all those guidelines and we need to recommend them what alternate therapy that we can which best suits to the patient. Okay, and especially when we are when they are giving some antibiotics to the patients. Okay, so especially we must pharmacists will play a major role in giving the antibiotics, IV antibiotics, mainly intravenous one. So where we pharmacists will keep on checking the guidance approvals and so on, and also making sure whether the dose of the antibiotic is appropriate and how long the antibiotic should be given. Okay, so all these things will be done by the pharmacist. So which means that in our day-to-day life, and we are not sure that in hospitals, like let's say for instance today if I get posted in cardiology ward, okay, and tomorrow if someone is not available in the neurology, then I need to go and cover there. Okay, so which means that I need to switch from one department to the another one. So one sort of the things to the another, like cardiology is completely different and the neurology is completely different. Okay, so in this way, we must be ready and we must keep on taking it like as a challenge, and every day it will be a new challenge and the new task that we'll keep on getting. But at the end of the day, like the level of satisfaction that we get as a clinical pharmacist in the hospital, working in the hospitals, okay, so that's the most important one that everyone they dream about. Okay, so because we are the ones, like the hospital, like the clinical pharmacists are the ones that they play a major role in saving the lives of the patients. Okay? So why I'm telling the saving the lives of the patient means because for whenever the doctors they chart the medications, there will be there are many incidences, there were a lot of errors that occurred, okay, and the pharmacists they have found those things and then they rectified those errors. Okay, so I'm proud of my profession, like by being working as a clinical pharmacist in the hospitals. Okay? And as I mentioned, that the job will be a challenging one, but at the end of the day, it will be highly rewarding and a lot of satisfaction that we can get.
Can we get the insights from Emily as well? I guess
I'm not sure whether if Emily is here. You can move on to the next question, Arshita.
Okay. Yeah. So what is the role of a rural pharmacist in Australia?
So, rural pharmacist, in the sense, there's no specific role here. Okay? The pharmacists who are working in the rural areas, especially the main thing I would like to emphasize here is about the hospitals. Okay, so let's take two hospitals. So one hospital is in Melbourne and the other hospital is in regional area. If you are a pharmacist working in a regional area, means you must be prepared for each and every task. Okay? Each and every task in the sense. So the pharmacist must know how to dispense the medication. The pharmacist must know how to do the ward round. The pharmacist must know how to attend the sepsis calls. The pharmacist must know to cover the acute ward. The pharmacist must know to cover the emergency ward. So everything the pharmacist should have, like an overall experience. Okay, the pharmacist should have an overall knowledge and overall experience when we are working in the rural areas, because in rural areas there is no specialties. Like we can't say that I can work only in cardiology department, or I can work only in the oncology, I can work only in the neurology. Okay, so such things are not applicable in regional hospitals. Okay, so in regional hospitals we must be ready, we must be prepared to start and to work in any department that they post to us. But when it comes to the big hospitals like in Melbourne or in Sydney, then in metropolitans, like the thing is, the major hospital, the big hospital, they will have all the specialties. Okay, so they will have all the major departments and the specialties are over there. And like in case if they post you for a rotation, I'm talking about the rotation, okay, 1 year rotation. If they post you in cardiology, then you will be working for 1 year only in the cardiology. You need not to go to other departments. You need not to go to the dispensing. You need not to go to oncology, neurology, nephrology, or any other departments. Okay, but in regional areas, we must cover each and everything. Okay, so your specialization, when it comes to the specialization, most of the KAPS qualified candidates, they will be asking about, sir, I'm interested to work like a cardiology pharmacist, I'm interested to work like a oncology pharmacist. Okay, so it's very good. Okay, so but there are certain challenges. So if you are a specialized pharmacist, if you are a oncology specialized pharmacist, means you can try to work, like you can get the jobs only in those hospitals which have that position. Okay, so in rest of the hospitals, like you can't go and work there. Okay, So, but if you are a general pharmacist, generalized pharmacist, okay, like you have the overall experience in almost all the departments, then it's opened. Like wherever the opportunity arises, easily you can enter and you can work over there.
Yeah. So for international farmer, for suppose, sir, if a student who has done BPharm or PharmD or MPharm from India and is aspiring to be a pharmacist, registered pharmacist in Australia or New Zealand, they need to write OPRA exam. Yes, we know. Like even Elite Expertise provides training. But how to increase, the knowledge, the fundamental knowledge of being a pharmacist? Like how they have to, they have to match with the standards, right? Like what qualities they have.
Exactly.
Yeah.
Exactly. So to increase the knowledge in the sense, so the candidates, they must learn each and everything, the basics. Okay. So without learning the basics, if we enter into the field, in any field, not only in the pharmacy field, even in the engineering field, or even in if you're if they become a doctor, okay. So anyone without having a strong basic foundation, strong basic knowledge, if they jump into any field, then they can they may not sustain there for a long time. Okay.
Yeah.
So they can just they can keep on working, but they may not improve their position from there. Okay. But the only thing that I can say that at Elite Expertise, when we are providing the training, either for the OPRA examination or even for the intern pharmacist, like for the written examination or for the intern pharmacist oral examination, so we feed them right from the basics, okay, from like how they teach in the school for a kindergarten, like ABCD. So in the same way that we keep on teaching them at Elite Expertise, because these are the foundations that they must have to become a outstanding pharmacist. Okay.
Yeah.
So even like I'm not saying that the candidates, there are many candidates who are clearing their exams. Okay. So even outside the Elite Expertise, they are clearing the exams. But what about like when they become a pharmacist? Okay. So the main thing is that we need to check their level of standards, okay, or the level of knowledge and the level of standards. Okay. So that's the important thing. So we always keep in consideration about those things. Okay. And whenever we are teaching, we teach from each and every aspect. Okay. So we take much time for teaching opera exam, and also for the interns, mainly for training for the interns is the most important one, because intern, if they get well trained during the internship, okay, then they play a major role when they become a fully licensed pharmacist. So while training the interns, so we take the almost like a full time, like every batch we will be taking like more than 300 to 400 hours time to we will spend with them. Okay. So we'll be conducting more and more mocks, and the real life practice scenarios will be explaining each and everything to them. Okay. So with that, they will learn and they will shine in their future.
Yeah. Arif sir, how to be a better pharmacist?
A better pharmacist in the sense, every day, each and every day, you need to keep on learning. Okay.
Yeah.
If you have the thirst to keep on learning every day, every single day, okay, then you will become the #1 pharmacist in your
Like how,
like
yeah.
wherever be the place that you are practicing. For instance, let me let's give my example. So I have been practicing, I have worked as a lecturer in Malaysian universities. Then I have been practicing as a pharmacist for the last 6 years, 7 years. I have been teaching for the KAPS. I have been teaching for Canada exams, that is the PVC exams. Okay. And for all these things that I have been teaching, but still every day, at least I will spend 2 hours time to learn. Okay.
Yeah.
I will keep on studying every day, like 2 hours. That is the strict timing that I will spend. Okay. So because if I don't study, if I won't learn what are the new trends that are going on, what are the new things that are happening in the pharma field, okay, then I may not sustain in this field for a long term.
Yeah.
Okay. So the only like mantra that I can tell is we must keep on learning every single day. It's not like, okay, we have finished our bachelor's, or we have finished our master's, we have graduated, so that's it, everything is done. So it's not like that. So we must keep on learning every day, then only we'll become
Better
we will
pharmacist.
reach our goals and become a better pharmacist.
Any personal, you have any personal experience with the patients? You have been working as a lecturer, training students, and also training, serving the patients, giving expertise to the graduates, undergraduates, and you have given training for the students who are above your age, who are of 65 age as well. Like, we
Exactly, yeah.
want to know the experience you have given training to that kind of student, and also the patient level where you have, you have served that patient, and which you have, that wonderful stories we want to hear.
Yeah, of course, yeah, especially when I started teaching my KAPS, we got many candidates who are like at the age of 65, those who cleared the KAPS examination. And I can say that I just did my job. Okay, so my job is just to teach them, okay, by considering each and everyone as a student. Okay, but I can say that they had a lot of patience. Okay, and they at that age, they spent that time to sit for preparation, and they have cleared those examinations. And now that gentleman that whom we are talking about with the age of 65, so now he became a fully registered pharmacist in Australia. So he spoke to me like 3 weeks ago, and he was sharing me about how his work is going on. And he was he was giving me he was telling that it happened mainly because of the knowledge that I have shared with him, and all those things. And he was much thankful to me. And yeah, so I can say that those things, that it really helps me, like as a trainer, where I'm training for these examinations. So once our candidates, when they become a fully licensed pharmacist, okay, and they started practicing like individually, when they are started practicing as a fully licensed pharmacist, then at that time, okay, so I'll get a lot of satisfaction. Okay, and the same thing even with the patients as well. Okay, so when it comes to the patients, then like I like whenever we do a lot of things, like in the hospitals, means we'll keep on doing a lot of things to the patients. Okay, so basic from finding the drug interactions and preventing the drug interactions. And also we'll always try to go above and beyond our level, and we'll try to help the patients. And once the patient, they get such type of the help, okay, and the satisfaction that, or when they come and say thanks to us, okay, so the level of satisfaction or the type of happiness that we feel, okay, so it will be like something, it will be completely different. So as I can say that what have been the things that I have learned personally in my life. Okay, so I finished my master's, my master of pharmacy from India back in 2012. Okay, and after that, I started my journey. I worked as a university lecturer in Malaysia, and then I moved to Australia and started working as a clinical pharmacist. Okay, so whenever I try to especially when I try to counsel the patients, and also when there are certain important things like trying to find the interactions and preventing the interactions. Okay, so all those things that mainly I got them through my previous experience. Okay, so my university teaching level as well as my practice level, that what I am doing here in Australia. So those things it helped me a lot in in reaching to this extent at the moment. Like right now, I'm a grade 3 pharmacist. Okay? So all these things that help me to go up to this level in Australian practice.
Yes, sir, that's all for today's webinar. Related to OPRA questions, related to any OPRA exam training, we are conducting a next webinar, which is happening on the next week. We'll be sharing all the details on our social media platforms and as well as on LinkedIn. We ask you to please join that session as well. It will be an exclusive session from Arif sir and Harika ma'am. Yes, sir, over to you for the last few words.
Okay, so first of all, I would like to thank all the participants, those who have joined for this webinar, okay, and has like those who have been stayed for like more than 1.5 hour. Okay, so I would like to thank everyone, and I would also like to thank Emily for providing her insights and her sharing her knowledge with us. And I hope everyone have gained some sort of knowledge out of this webinar, and those who are planning to become a pharmacist in Australia, okay, those who are at the level of writing the OPRA, or those who are at the level of writing their intern examinations and to become a pharmacist in Australia. Okay, so I hope, I wish all the best on your journey, and hope to see you soon as a fully licensed pharmacist in Australia or anywhere it is, like Canada, US. Okay, so whatever the country that you are dreaming, so hope to see you as a fully licensed pharmacist in their countries. Okay, so that's it from my end. Thank you so much.
Yeah, that's all for today, guys. Thank you everyone for joining this webinar. I hope this webinar adds some value to your ongoing pharmacy journey. And don't forget, it's elite expertise where practice meets excellence, in my words. So bye bye, guys. Stay tuned to Elite Expertise.
Thank you. Thanks, Arif. Thanks, team. Bye.
Yeah, bye bye.
Thank you.